I get a lot of questions about food allergies. We hear a lot of different kids having food allergies these days, and I know it can sound scary that as you're introducing your baby to foods that they could have a food allergy. It still is very unlikely that most kids will have food allergies. Unless there's somebody in your family who has severe allergies, and especially a parent or a sibling of the baby, that puts them a little bit higher risk, but still it is a fairly low risk. And so I tend to say it's okay to start foods and go pretty quickly with how you're going to expand. We also now are recommending that you start some of the foods that can cause allergies at an earlier age. There has been new allergy research that shows that if babies are exposed to some of those allergy type foods early, they have less likelihood of having any reaction to them as they get older. And these are foods particularly like peanuts, nuts of all different sorts, as well as fish, shellfish, and eggs. So we actually do recommend starting those sometime around 6 months. It depends a little bit on when your baby is ready, because some of those foods are going to have a little bit more texture. So sometime between 6 and 9 months is a really great time to introduce all those foods. Of course, if you're going to introduce a food like those, you want to probably separate them out a little bit by a couple days, just in case they were to have any type of reaction. Now, what kind of reaction could you have if you're having a food allergy? One of the most common is you could have a rash. And the type of rash that we see with food allergies is hives, which is basically a raised red bump that tends to be everywhere on the body, not just in one little spot. They tend to be very itchy. So that's one thing to look out for. Another issue we can see with allergies is vomiting. So if your baby pretty quickly vomits up the food right after, it definitely could be a sign of allergy. If you see either that rash or the vomiting, or if your baby just seems unusually fussy after a certain food, or certainly if they get any swelling around the lips or the tongue, or it seems like they're having any hard time breathing, of course we want you to call 911 and get immediate help. If you see some of the less concerning allergies, what I would recommend is stopping that food for now, and then depending on how severe the reaction was, you may want to try it again in a month or two. If you're unsure if it's safe for you to try that food again, you may want to contact your pediatrician to check in and get a little bit more information about exactly what the reaction was. In terms of the allergy concerns, some parents feel more comfortable if they know exactly what to do when an allergy might happen. It's safe to have something on hand like children's Benadryl or children's cetirizine or Zyrtec, just in case your baby does get hives or have a vomiting or another reaction that concerns you. I would still probably call in to the Kaiser call center or talk to your pediatrician about it, but it can be reassuring to have that on hand just in case you need it. Now, during this current coronavirus time, when we are having less medical care, you may want to be careful about how quickly you introduce foods. Definitely introducing foods like vegetables is very safe and very low risk of having any allergy. Now, if your baby has anybody in the family with an allergy risk, or if your baby has severe eczema or severe asthma, that might put them at higher risk for having an allergy. And it may make you want to hold off a little bit longer on some of those foods. Because some of our medical care isn't as easy to access right now, some of those high-risk people should probably hold off on some of the higher risk foods. However, if your baby has no family history of it and everything seems to be going well with some other solids, I think it's okay to go ahead and proceed with most feeding as you normally would.